Good evening, Twin Cities. This is your host, Clarence Jones. Tonight on our show, we have Dr. Kevin Gilliam, who's with NorthPoint. He is a family medicine doctor, and he has been involved in our community for a long time. And we're just excited to have him here as we began to talk about COVID-19. Not that we're excited about COVID-19, but we know that it's here, and we know that there are activities and there are things that are going on in our community that we need to be aware of. And NorthPoint, as a federally qualified health center, has been instrumental in terms of helping us to understand the health care issues of our community. And so we know that COVID-19 has been in the forefront, and now the whole issue around immunization is in the forefront. And we know that when we have talked with other individuals or we've listened to people talk about it, there's been a lot of resistance, especially in the African American community. And so I just want to start off our event tonight. But first of all, welcome you, Dr. Gilliam.
Thank you. Thank you.
Okay. All right. I tried to set this up. So I want to ask the question. There's a lot of resilience in our community around taking vaccines and immunization. Is it justified?
I would say that, some of the hesitance that we've seen or hear about in the community is justified. If people, are aware of the history of the relationship with the Black community and medical systems, particularly in this country, you'd be perhaps even foolish to think that someone might not think twice before just accepting something without doing some research in advance. We can look back to the supposed or titled father of gynecology, who would do surgeries or practice surgeries on enslaved women without the use of anesthesia to perfect his procedures. Look to the Reconstruction era, where many in the healthcare system, the doctors and hospitals would not see us. We then would not be allowed to have care or not have care, and then lose life due to illness and the like. Later on in the 20th century, there were these forced sterilizations that happened up through the middle 1900s. So not too long ago. And then, the more famous of them all, the Tuskegee experiments that happened, what was that, from the early 1900s and only ended in the middle 1970s because a news reporter found out about it. So there is some justification for people to have some hesitance when we know historically we perhaps have not been, or we have not been kind of respected and looked upon in a humane way. I think, keeping those things in mind and knowing that things are in this situation different, I would suppose, one of which is that the microscope is shined on this process. Like, everyone is looking. There is no stone going unturned. All those critical thinkers, those critical eyes. There's several, in particular at NorthPoint, several of us clinicians, docs, pharmacists, have read all the studies, have had discussions around those studies and, looking at safety protocols and the like. And so, to answer your question directly, yes, there should be, or yes, there is hesitance, and yes, it is justified. But I think what we need to weigh in that is the reality in which we sit with the Black and Brown community being greatly impacted by COVID-19. In this state specifically, the death rates are not as high or not higher in relationship to other populations. But the hospitalization rate is really high comparatively for Black, Native American, Latinx populations. And so when you're hospitalized, you're extremely sick, and we don't know what the long-term impact of that will be. So anything that we can do to decrease the numbers of people who are getting sick, and particularly sick enough to be hospitalized, will then reduce the number of people that will then have these long-term consequences that we don't know what they are yet. Today, they were having this discussion is the 1-year anniversary of the first time anyone in the United States heard anything about this suspicious pneumonia that was in Wuhan, this cluster of pneumonias in China. And then 1 year later, we're now up to 19 million people who've been infected, and somewhere north of 300,000 in the United States who have lost their life due to it. It's.
So let me push you. Okay.
Yeah.
We said this is community health dialogue, and so I'm not trying to start no fight. I'm just trying to ask some questions. Okay. So with all of the things that you have talked about, in terms of the past and the history, shouldn't we just get over it and just accept these vaccines? I mean, these safeguards that are in place now, shouldn't we just say, okay, let's say?
Well, no. I think get over it, I think is not the phrasing I would use. I would shine. I like, shining that light, and making sure that we are all aware of those things, and then but in the same respect, or second half of the sentence, making sure that we are fully armed with the information that we need to make an informed decision.
Okay.
So if you look at your personal situation and you say, you start checking off boxes of risk, if you were to be infected with COVID-19, so we know that Black people, other people of color, oftentimes will not do as well. So you check off if that's one box for you. If you have a chronic medical condition, so if you have diabetes, there's another box. If you smoke cigarettes, there's another box. If you have asthma, there's another box. If you live with an elderly family member, there's another box. So if you start looking at your risk, and after having done, listen to people, read things, and come to a decision, weighing out, okay, if I get infected with COVID, do I think my risk is high? Or by taking this immunization to help prevent me from getting COVID, which of those do I think is a higher risk? And I would wager that the higher risk at the moment would be to become infected with COVID-19, the virus.
So, when the information came out about the vaccination or about vaccinations, people were always stressing how it takes 7, 8, 10, 12 years to process a vaccine.
Yeah.
And, we started in March, and by November we had a vaccine, and people were like, oh, wait a minute. Where is this going? So my question to you is, in what way was this vaccine processed differently, and why?
Yeah, it's a good question. This type of vaccine is what's called an mRNA vaccine, which is a messenger ribonucleic acid. So there's RNA and DNA, and RNA is a type of kind of information thing inside the cells of our body. Now that type of technology has been around for a couple of decades now, but this is the first, or these two vaccines are the first ones that have been made as vaccines anyway. Now, classically, so if you look at your kind of flu vaccine. The process in which those are made is that they take a weakened version of the virus or some piece of the virus, and then they grow that, and they spend time growing that virus, and then apportioning it and making a vaccine from that. With this, in this particular case, very early on in the process, the genetic code of the COVID-19 virus was known, within a month or so of our becoming aware of its existence. So with that knowledge of the genetic code itself, we were then able to look at the pieces of the virus and figure out what the genetic code of those pieces were. And then from that, the technology for the mRNA was already there. So then we just had to insert the code into that mRNA. And then you have a portion of COVID-19 encoded messenger RNA that can then be used as a vaccination. And so they were able to start trials much earlier than they typically would have been, because they did not have to wait for the vaccine or the virus to grow, because there is no actual virus in this vaccine. What you're getting is a message inside this vaccine that tells your cells what protein to produce, so that your body recognizes it if it comes in as COVID-19.
It's interesting. You use a lot of, medical terminology for the description, which I kind of understand. And so what it brought to my mind was about the trust factor.
Mm-hmm.
And I know that a Black woman was part of this process, and Dr. Fauci was sure to mention that. And so with all of these different things, I think that what you're saying is that there is and you talked about this a little bit earlier. You talked about the fact that there are many ways of checking and inspecting and reporting with this process. And so that we as a community, especially a Black and brown community, should be a little bit more, or should be less resistant. Because I still think that you need to do your homework. And
Right.
You talked about being fully informed. I still think you need to do your homework, but there's a little bit more of a comfort level knowing that we had a part of the process.
Yes.
That was kind of a question there. We had a part of the process. Is that how you think?
Well, I think I'll be careful with that. I mean, it's assuring to know that they are showing everyone who's been involved in the process.
Okay.
But I think everyone that is looking at history, everyone who says they're your friend is not necessarily your friend.
Sure.
And I know nothing of the people who crafted the immunization.
Right.
So I would listen to what people say, read and do my own research, which I've done, to verify and to look and to see that what they are saying is true based on the information that I have, and then looking at the risks that I particularly may carry, and then making a decision. Because at the end of the day, the person getting the immunization will be you or me. Right. And so you have to make that decision for yourself. And then, but you're making a decision for yourself, and then by proxy, your family, by proxy, those in your community, and so forth.
It's interesting because I'm not going to ask you whether you'll take the vaccine or not. Okay. What I'm going to tell you, I would tell you what I originally thought. All right. Mm-hmm. Which was like, heck no, I'm not going to do it. Okay. But after having the opportunity to talk with people, it shifted my mindset. I haven't had the vaccine yet.
Yeah.
Okay. And I know that there's a distribution plan this year But can you talk about the, I'm like I said, can you talk about the kinds of vaccines that are available now? I know that there is Pfizer, and then there's
Mhm.
the other one. I just heard about a third one that's being vetted by the UK today. But
Right.
can you talk about the three choices that we may have?
Yeah, at the moment, there are just two choices. So
Okay,
there's the Pfizer vaccine, which is mRNA, as we were talking about, and then there's Moderna, which is also mRNA. And at the moment, the Pfizer vaccine, which the storage of it needs to be like super cold and kept in
right,
specialized freezers. That's mainly being done in hospital settings. Um, and so those are your that first tier of people, like your ER, your ICU staff, and those who work in the hospitals on the floors and stuff. And then the Moderna vaccine is actually the one that we will likely be getting here at NorthPoint. And that one does not require that super cold storage. It is kept in a freezer, but it's a regular freezer. And that one is also an mRNA vaccine, um, both of which Pfizer is at 95% effectiveness based on the studies, and the Moderna is at 94.5% effectiveness based on
right.
those studies. So they're both, really by the numbers seem to be really good at doing what they're purported to do. And there is a third one that just entered the third. Um, I heard the same thing that I think it was AstraZeneca's vaccine, and I haven't read those studies yet, so I'm not sure what um, type of vaccine that one is. It may be an mRNA, but it may be what's called a protein derivative vaccine. So I'm not certain at the moment, because that would be more of your uh, classic vaccines, is for lack of a better term.
So let's talk about this. You mentioned that there has been some distribution of vaccines, and you were saying that we know that they're happening around the world. We know that North Point is going to get some, right? And so
Yes.
your friends are going to be lining up. They're going to want to get it first. But
Mhm.
is that how the distribution plan works?
It's not. It's not. It's we've been planning for weeks now, looking at those who might be highest risk within our clinic building. So we would want to vaccinate those who are working directly with COVID positive or potentially COVID positive patients and clients, and then those who interact fairly intimately with people daily, and then those who would likely also be giving the immunization to people once we have enough immunization to then roll it out to the community that we serve.
Okay.
Um, and the next tier of people beyond healthcare that the CDC has recommended is outside of the nursing home and long-term care facilities are those greater than age 75, and then essential workers, which includes a lot of people. So then we would kind of work to prioritize who in that group would go first, and waiting on guidance from Minnesota Department of Health um, and CDC for that.
So knowing that that there is a plan for who will get the vaccine. What about those that won't get it as quickly? What should be their what would you say their guide the COVID guidance for them should be in terms of masking and in terms
Mhm.
of social distancing until they can get access to the vaccine?
Well, what I'll put a clarifying point on there. The
Okay,
guidance is the same for those getting vaccine and for those not getting vaccine.
okay,
So you still need to mask, even if you got had both of your shots. You still need to social distance, and you still need to wash hands, because there's still risk present. And the goal would be to get somewhere north of 60 to 70% of people um, uh, immunized against COVID-19 for it to really um, have a serious impact on kind of how we move in the community.
So one of the things that I always like to ask is, what could you really say to the community? Remember we talked about, there are times where you have to pull off your gloves and you just have to say what you got to say. What would you really want to say to the community during this time? I say always use the term, you can be politically incorrect. As a doctor, you're seeing a lot of things that's going on. I don't know how many deaths you've seen. I don't know how many people you've seen struggling. I know that
Yeah.
there've been a lot of people that have resisted the mask, like, you can't take away my freedom, and I'll breathe on whoever I want to breathe on, those kind of things. What would you really say to the community around this issue, around COVID-19 and around, let's just start with COVID-19. What would you really say to them?
Well, I see people every day and talk to people every day who've had COVID months ago and are still suffering the consequences of it. They previously were, fairly healthy, and now they, have breathing issues or, can't walk quite as far as they used to. I think oftentimes we don't take things seriously unless they impact us closely.
Sure.
I've talked to more families than I like to have had to, surrounding after or during the death of a loved one, that they were unable to visit, unable to see, losing mothers, grandmothers, fathers, grandfathers, aunts, uncles, nieces and nephews, to a virus, and then potentially having to carry the weight of being a potential reason for exposure, knowing that it's no one's fault necessarily, but it's just a heavy load to carry and to bear for people. And in the very beginning of all of this, there was the perception in the community that it wasn't impacting Black people as much. But then a few months in, we started to see, those numbers were not the truth, that it really was hitting us hard. And, you don't have to listen or believe a word I say. Just look and see what the changes in the community have been. Who's not there right now? Like, where's that old guy that used to be over there? Yeah, that mother of the church. When's the last time you've been to church? You're not. Have you been to an in-person service? The way things have changed this year has been astounding. And so, taking all those things into account, there is a light now that we see kind of at the end of the tunnel. But we still have to continue the work that we've been doing. We don't get enough credit in the community for actually doing work. The good numbers that we're seeing in this state right now are because we have done what has been asked, which is to mask and to social distance and all that. And there are always going to be people who don't do the things that are recommended, but there are enough of us doing the things that will help the entire community. So that's what I would say about that.
Yeah. So knowing that people that will listen to this they're going to want to follow up. And so where can they follow up with NorthPoint to kind of figure out, where they can get informed information, and then they can find out more about maybe the distribution of vaccines or, because right now there's been so much misinformation. I think that NorthPoint has worked very hard to be a point of trust in the community. And so they're going to ask. And so where do you suggest that they go to on your website or your phone numbers or whatever, where people can get the information they need?
Yeah, so if you want to go to to our website, which is NorthPointHealth.org, you can find a link to CDC and other places to get additional information. Listening to the news, because as everything this year has been quite fluid. So things change, and we get distributions of things that come directly to us or come through the Minnesota Department of Health. So just paying attention and being aware when, so if we're talking of immunization, when your grouping or your tier becomes available. So if you're an essential worker, or if you have chronic medical conditions, and they say that this is the time for those people to start getting immunized, then calling us, if you are a patient with us, or calling your primary care physician or clinician to see about your immunization, if it's to be done through the clinics in that way. But you can always call our call center for information. So 612-543-2500, and they can help in directing you wherever it is that you may need, be able to get some assistance.
Well, Dr. Gilliam, I just want to thank you for your time that you've taken to kind of share with us and have this candid conversation about immunization. I really want to thank you for being open about the vaccination and the need for vaccination and why, and some of the tools that we need for this process, and some of the things that we need to be thinking about. And I just want to thank you for your time, and for NorthPoint, which is the sponsor of this show, for making sure that our community continues to get good information so that we can become healthier. So thank you again. And listeners, I want to thank you for listening to Community Health Dialogues, and we will talk with you again next week. Have a great evening. All right.